Madam President, I'm pleased to see that on the floor today we continue to make progress on the Comprehensive Addiction and Recovery Act. The legislation before us today and yesterday and this week has been about how to deal with this growing problem we have around the country. And it really is at epidemic levels of heroin and prescription drug abuse, addiction, overdoses. Today, while we're talking about this legislation on the floor of the Senate, we expect over 100 Americans will die from overdoses of addiction, overdoses of heroin or prescription drugs. This is a problem that doesn't just affect my state of Ohio, although we're one of those states that's most severely impacted. It affects every single state represented by everyone in this chamber. That's why over the past few years you've seen this body come together, Republicans and Democrats alike, to address the problem. And Senator Whitehouse and I have been the co-authors of this effort, but so many others have been involved. Senator Ayotte, Senator Klobuchar, Senator Feinstein, who's on the floor right now, has been supportive of the legislation, but also improved the legislation with an amendment which was accepted earlier this week, dealing with the international drug cartels. There is an effort in this body to take on this issue, not in a partisan way, but in a totally nonpartisan way. Last week, I was in Ohio, meeting with groups, talking about various issues, and every single place I went, this issue came up. I was on a plant tour, and people talked to me about it. We had a town hall meeting at that factory, and at the end of the town hall meeting, after talking about taxes and energy and healthcare policy and other issues, I just asked for a simple show of hands. How many of you have been affected, or your families or friends have been affected by this new opiate addiction issue, heroin and prescription drugs? Half the hands in the room went up. And they went up because this is something that is tearing at our families, at our communities. It's devastating so many of our communities, and the cost to the taxpayers are also tremendous. I went to a hospital, and what they wanted to talk about was how the emergency rooms are being filled with people who are overdosing or abusing drugs. I have been to 3 different hospitals in our state who are doing amazing things to care for those babies who are being born with addictions. There's been a huge increase in my state of babies who were born because of their mothers being addicted during the pregnancy. They're actually born with an addiction to opiates. And they have to take these babies, some of whom are so small they could fit into the palm of your hand, through the withdrawal process. We don't know what the long-term consequences are for many of these babies because this is such a new issue, but we know that this is something that, again, is tearing at our community. So it's time to address this issue. There's been a recognition of that, and I'm very encouraged by the progress we've made this week on this legislation. I hope we can find a way to get to the final amendments and get the legislation passed, because it's urgent that we deal with this. The House of Representatives has their own legislation. It's also called CARA, Comprehensive Addiction and Recovery Act. It's bipartisan also, and we believe that if we can pass this bill with a strong vote here, and we had an 89-0 vote to get onto the bill itself, to actually move to the legislation, which was very encouraging. We believe if we can get a strong vote, Senator Whitehouse and I believe that we'll get a strong vote in the House as well, and we can get it to the President, to his desk for signature, and begin to reverse this trend. The legislation is something that went through a unique process around here, which is bipartisan or even nonpartisan from the start, and a process of bringing in experts from all around the country. Rather than us saying, we know all the answers, we're going to write this legislation, we said, let's hear from others. So Senator Whitehouse and I, Senator Ayotte, Senator Klobuchar, and others, we held a series of summits here in Washington. We brought people in. Many of us have done this in our states as well, but here in Washington alone, we had 5 of these conferences in 2014 and in 2015. We brought experts in from around the country, but we also relied on expertise from the administration. In April of 2014, we held a forum on criminal justice and how it's affected by this issue, and treatment and alternatives to incarceration, because one of the things this legislation does is encourage diversion out of the criminal justice system for those who are addicts and get them into treatment. It was an excellent forum. It featured Michael Botticelli. In my view, he has been a very effective director of the Office of National Drug Control Policy. He's called the Drug Czar. This is within the White House. Michael Botticelli came as a representative of the White House, but so did a representative from the Drug Enforcement Agency, and gave us great input. In July of 2014, we held another forum. This was on how women are impacted by this drug epidemic. looking at addiction and treatment responses. We talked earlier about this issue of pregnant women being addicted and their babies. Again, this forum featured Michael Botticelli, who was director of the White House Office of Drug Control Policy. In 2014, in December, at the end of the year, we held another forum. This was on the science of addiction and how we could potentially address the collateral consequences of addiction. This forum featured Dr. Nora Volklaw, who is director of the National Institute on Drug Abuse in the Obama administration. It also included the Department of Justice and Substance Abuse and Mental Health Services Administration officials. So SAMHSA was there, DOJ was there. By the way, again, Director Botticelli was there as well, and I appreciate him coming up for that forum, which was very helpful to us. Then last year, in April of 2015, we held a forum on our youth and how we can better promote drug prevention, as well as develop communities of recovery for those who are suffering from addiction. Prevention and education is a big part of our legislation. And clearly, we need to do a better job to get people to make the right decisions to avoid getting into the funnel of addiction in the first place. This forum featured officials from the Office of National Drug Control Policy in the Obama administration. Also, it had officials from the National Institute on Drug Abuse. Lastly, in July of 2015, last year, we held a forum on the impact of substance abuse and PTSD on our veterans. It was focused a lot on the issue of addiction and the high rates that we see sometimes of mental health and addiction coming from some of our returning veterans. This forum featured one of the giants in this field, General Barry McCaffrey. General McCaffrey and I have worked together since his days as director of the Office of National Drug Control Policy in the Clinton administration. He is not just a giant in this field, but he gave us great input as to how to write good legislation to help us with regard to veterans courts, which we have as part of this legislation, where veterans can get the help they need to get their lives back on track. That forum, by the way, also featured officials from the Department of Defense, Department of Veterans Affairs, and the Office of National Drug Control Policy. From all these participants in this process, we received a lot of great feedback that helped guide us as we wrote this legislation. In fact, we went back and forth with legislative language with all these experts in the Obama administration, as well as experts from around the country. This legislation is supported by over 130 groups, including those representing people who are in the trenches, providing treatment, providing services on prevention, law enforcement, doctors. Those who are involved directly in this issue have given us a lot of guidance, but that included the expertise of these experts in the Obama administration. I'm appreciative for that expertise and for their support of our efforts. Because it was such an inclusive process, because it was a bipartisan process, because of the encouragement and assistance we received from the drug experts in the Obama administration, when we introduced this bill, actually said, okay, here's our final product. After the back and forth on all the legislative language and with all the experts, this bill received a lot of support immediately on a bipartisan basis. As I said earlier, indeed, 130 national groups now support it, in part because they helped write it, in part because some of them, even who might not have been involved intimately in the process, are looking at this problem and realizing that this is a solution that will really help. We've also got dozens of groups in my home state of Ohio who have supported it, in addition to these 130 national groups, from the Fraternal Order of Police to the National Attorneys General Association, to folks who are involved day to day in helping to deal with this issue at their local level. Yesterday, day before yesterday now, I believe it was, we received a statement of administration policy from the political officials at the White House on the CARA bill. And I've talked about how the administration's been so helpful and their experts have been so helpful, but despite all the work that they have done to support this bill, the White House did not issue a statement of administration policy that supported the legislation. It didn't oppose the legislation, but it said instead that the drug epidemic would not be affected greatly by this legislation unless there was substantial new funding provided. Now, this is kind of incredible, given that this is the legislation we all worked on together. And I know that there's a difference between the political folks at the White House and the people who actually know the issue and are the experts on the issue. But I would hope that we could get a strong statement of administration support for a bill that was drafted with them on a bipartisan basis with Senator Whitehouse, myself, Senator Klobuchar, and others. But we'll see. Now, I support additional funding over and above the $80 million in new funding that CARA provides for, not just for this year, but for next year, the year after that, and the year after that. It's an authorization bill. It's extremely important. And I supported the Shaheen Amendment yesterday But it's factually wrong to say, as some of my colleagues have claimed, and the White House seems to be saying, that there's not funding for these CARA programs. In fact, we've already appropriated, as my colleagues know, significantly more spending for this opiate problem for this fiscal year that we're in. Not a penny of that has been spent yet, by the way. Over $120 million of additional spending. That $120 million of additional spending is targeted on ways to spend the money more wisely through CARA, because we worked with the appropriators, we worked with the Judiciary Committee to ensure that that was the case. Having said that, again, I would love to have seen more funding over and beyond that provided by an amendment that was offered by my colleague Senator Shaheen yesterday, because I think that would have helped even more. But it doesn't mean that we shouldn't strongly support the underlying CARA bill. And in fact, my colleagues who have endorsed it and voted with us, and my co-authors, Senator Whitehouse and others, agree with that. Because this bipartisan bill ensures that more federal resources are going to be devoted to evidence-based education, treatment, and recovery programs that actually work, that we know actually work. It's not just throwing money at the problem. This is actually legislation we know works to address the problem based on all of the background that I just mentioned about getting all the expertise. Again, these groups out there who are in the trenches every day working this issue are the ones who will tell you why it's going to work. But what they will say is it's going to help these young mothers battling addiction. It's going to help those veterans who return home from duty, who desperately need our help. It's going to help young people make the right decision. It's going to help that teenager who's struggling with drug abuse. It's going to help in terms of dealing with this problem we have right now where people can't get treatment because there's not enough access to treatment. It's going to help in terms of ensuring that we get prescription drugs off the bathroom shelves so that they're not being used to get people addicted to opiates and then moving to heroin. It's going to be helpful to ensure that we have a drug monitoring program nationally so we know who's getting overprescribed and who's not. These are changes in law that are part of this legislation. Again, I want to thank the experts in the Obama administration who deal with this issue every day and who strongly support CARA. On January 27th, 2016, so at the end of January this year, the Judiciary Committee held a hearing on our bill. I was able to testify, as well as others, including experts. Here's what some of the leading administration experts said. First, Michael Botticelli, again, a guy who I think has been a very effective director of the Office of National Drug Control Policy at the White House. Here's his quote. There is clear evidence that a comprehensive response looking at multidimensional aspects of this that are embedded in the CARA Act are tremendously important. We need to we need to do more. And I think that all of those components put forward in this bill are critically important to make headway in terms of this epidemic. That's the director of ONDCP. Here's from Dr. Nora Volkow. Dr. Volkow is director of the administration's National Institute on Drug Abuse and a real expert. She said, and I quote, "We support the comprehensive program delineated, and it is one of the strategies to address the problem." Here's Ms. Kana Enomato. She's the acting administrator of SAMHSA, the Substance Abuse and Mental Health Services Administration. She said, and I quote, "At SAMHSA, we are so excited to be able to implement programs like the medication-assisted treatment in CARA, prescription drug and opiate addiction, which Congress appropriated in 2015, and then another increase in 2016, which is very similar to some of the programs you described in the CARA Act. Thank you, Senator Whitehouse, for your leadership on this issue and continued support of our mission. We believe that the public health approach of the CARA Act is vitally important to moving forward on this issue," end quote. Here's Mr. Millinone. Mr. Millinone is the Deputy Assistant Administrator, Drug Enforcement Administration, Office of Diversion Control, and he said, and I quote, "I'm happy to work with you or anyone on this legislation that will help with this epidemic." I'm thankful, again, for these experts in the Obama administration who have put politics aside to work to support CARA. They've helped us to come up with better legislation, and they support it because they know it will help promote education and prevention so we can stop drug abuse before it begins. They support CARA because they know it helps with treatment and recovery and will help reduce overdoses to save lives. They support CARA because they know it will help our veterans as well as women and babies who are suffering from addiction. They also support CARA because they know there are more than 130 groups out there, national groups, who understand the importance of this bill and support it, including the National Association of Addiction Treatment Providers, Faces and Voices of Recovery, Children's Hospital Association, the Partnership for Drug-Free Kids, Fraternal Order of Police, and I thank our law enforcement for stepping up on this, the National District Attorneys Association, and the Major County Sheriff's Association. I understand, Madam President, that some folks in Washington like to play politics with everything around here, but politics has never been part of this bill. It's been inclusive from the start. and it's been bipartisan from the start. We're here to help those suffering from addiction and to save lives, and that's exactly what this measure will do. Let's get on with it, pass this legislation so we can get it to the President's desk for signature, and it can begin to help. I yield back, Madam Chair.